Welcome back to the deep dive. Today, our sources are taking us into a pretty complex and, let's be honest, really debated area. Hormone blockers. We're going to focus specifically on one drug you might have heard of, Lupron.
Right.
And our mission, like always, is to try and cut through all the noise. We'll use the material you shared with us to look at its, well, surprising origins, how it was marketed pretty aggressively, it seems, the dangers that have been documented, and where things stand now, especially with its use in kids.
Yeah.
We're really aiming to pull out the most important nuggets for you from this stack of sources.
And I think what's really crucial to get right from the start, and the sources really hammer this home, is this core tension. I mean, these drugs are presented as some of the most dangerous ones out there, yet they've been used incredibly widely and, in increasingly questionable ways for decades now.
Okay, so let's start with the basics then.
Right.
What exactly are these hormone blockers? How do they actually, stop the body's hormone production?
Well, the signal for sex hormones, so we're talking estrogen, testosterone, that signal actually originates up in the brain.
Sorry.
And the most potent blockers, the ones we're focusing on, are called GnRH agonists. That's gonadotropin-releasing hormone agonists. Think drugs like Lupron, Vantis, Suprenlin.
Right.
They work by essentially overwhelming the brain's receptors for GnRH. They just bombard them so much that the receptors kind of get burned out. They become unresponsive. So they start responding to the body's natural GnRH release, and that effectively short-circuits the whole sex hormone production line. It's almost like, ringing a doorbell constantly until nobody bothers answering anymore.
So it's like this constant, overwhelming signal just shuts the system down.
Yeah.
And the sources suggest this shutdown. It can sometimes be permanent, is that right?
That's exactly it.
Yeah.
The signal is so intense, the system basically tunes it out. And yes, that specific hormonal pathway, it can be permanently unaffected in many cases. It's a very powerful mechanism. And it's probably worth mentioning quickly, some other drugs, like Orilissa, work a bit differently. They block the receptor directly. But yeah, our main focus today, based on the sources, is really Lupron and that class of drugs.
Got it. Okay, so understanding how they work, let's dig into Lupron's origin story, because the sources lay out this really fascinating journey, how it was first developed, how it got approved.
Yeah, it's quite something. Lupron's initial research, it was all about reducing testosterone levels. The thinking was testosterone fuels prostate cancer growth, so let's reduce it.
That makes sense.
Back in 1984, there was actually a study comparing Lupron to DES. Now, DES was an estrogen analog, and it had its own really severe problems causing harm even to the children and grandchildren of women who took it.
Oh, wow. I remember hearing about DES.
Yeah, it was nasty stuff. So this study looked at Lupron for advanced prostate cancer, the kind that's often fatal, and it found, similar side effects between Lupron and DES, actually. Lupron showed maybe a slight edge in survival rates.
And that was enough for the initial FDA approval.
That's what happened, yes. It got approved as an alternative treatment for advanced prostate cancer. But, and this is important, our sources point out that even then, the FDA apparently had concerns.
Concerns about what?
About flaws in the studies and the fact that they didn't fully understand how Lupron was metabolized in the body. But the really significant part is what happened after approval. Over time, more dangers started popping up.
Like what kind of dangers?
Things like an increased risk of fatal heart attacks or diabetes. Some analyses we looked at even suggest that, any drop in prostate cancer deaths might have just been because patients were dying from these other causes first.
Oh.
Not necessarily because the drug was directly beating the cancer in those cases.
That's a critical distinction. So, okay, it gets approved for this one very specific serious condition, advanced prostate cancer.
Right.
But then its use balloons.
Absolutely. It expanded way beyond that initial use. Suddenly it's being used for advanced breast cancer, endometriosis, prepping for fibroid surgery, and IVF protocols, even for chemical castration of sex offenders.
So it started for men, but ended up being used widely for women too, often off-label.
Very frequently given off-label to women, yes. And the sources highlight this weird contradiction. The official FDA insert for Lupron apparently says its only approved use is palliative treatment for advanced prostate cancer.
Okay.
But then in the same insert, it warns pregnant women not to take it, even though it's commonly used for egg harvesting as part of IVF.
That doesn't quite add up. And what really jumps out from the sources is this claim that, look, Lupron's been around for decades, used for all these different things. But there's supposedly very little actual evidence showing it benefits people for most of these off-label uses. That feels like a major disconnect.
It really is. And it leads directly to the next big question.
Exactly. If these drugs carry such serious risks, and like you just said, the evidence for benefit in many cases is shaky at best, how the heck did they become so popular? What drove this massive expansion?
Well, this is where it gets really fascinating, according to our sources. The manufacturer apparently found this incredibly effective loophole. It was all about how chemotherapy drugs are priced.
A loophole? How so?
They reformulated Lupron, turned it into a long-acting monthly shot that urologists could give directly in their offices.
Ah, so the doctors administer it themselves.
Exactly. And that allowed the doctors to buy it, mark it up, and bill insurance, particularly Medicare, for a much higher price. The sources say Medicare payments shot up to like $1,200 per shot.
$1,200 for one shot. So it suddenly became extremely profitable for the doctors prescribing it.
Extremely profitable, and apparently there were also bribes, free samples given to urologists to encourage prescribing, which eventually led to a massive fine, like $875 million, against the manufacturer for illegal marketing.
Wow.
But that profitability, it really worked. American urologists started using Lupron much more widely, even for less severe, more benign prostate cancers. By the late 90s, we're talking nearly $1 billion a year just on Lupron treatments.
$1 billion.
Yeah. And get this, at one point, Medicare payments for Lupron made up 40% of the average urology practice's income.
40%.
Yeah.
Just from this one drug. That's a staggering financial incentive, even if the clinical benefit wasn't always clear.
It's huge. Eventually, Medicare did step in. Around 2001, 2003, they cut reimbursements. And that did curb the excessive use somewhat. Rates of inappropriate hormonal treatment for prostate cancer dropped.
And what happened to the doctors' incomes?
Well, many urologists reported their income was basically cut in half. It really shows how much those payments were driving the prescribing habits.
Yeah, no kidding.
In fact, there was one survey mentioned in the sources. It found that 53% of urologists who admitted they didn't believe Lupron actually benefited certain prostate cancer patients still prescribed it anyway.
Deeply concerning.
It is. And then this profit model, it spread. Other specialties saw the potential, particularly OBGYNs. So you see the surge in off-label uses for gynecological conditions, even with poor efficacy data and these crazy high prices. Patients were getting bills for like over $10,000 for a single shot sometimes.
It's $1,000.
And crucially, the sources point out, when patients started experiencing bad side effects, they often weren't believed by their doctors who, had this negative incentive to downplay problems.
That whole picture is just incredibly disturbing. So let's talk about those consequences. What are the actual devastating effects on people who've taken Lupron? And tied to that, with such severe harms documented, why aren't more people getting justice through lawsuits?
Well, the sources we looked at describe Lupron as one of the most dangerous drugs on the market, and that's because of the sheer number and severity of the injuries reported. I mean, the FDA's own inserts apparently list dozens of severe side effects.
Dozens.
Yeah, with rates anywhere from 5% to 50% of recipients experiencing them, depending on the specific symptom.
Can you give us some examples? What are the most common, or maybe the most severe ones, highlighted in the material?
Sure. One big one is bone density loss, significant decreases leading to fractures, chronic dental problems, teeth cracking, breaking easily, unexpected fractures just from minor bumps or stresses.
And this can happen long after taking it.
It can happen quickly, but yeah, it can also show up years later. Then for women, there's long-term or even permanent damage to their menstrual cycles. Many don't return to their baseline ovarian function even a full year after stopping the drug.
Wow.
Plus other things like permanent weight gain, abnormal periods, hot flashes, vaginal atrophy. And sexual dysfunction is a big one, too. High rates of impotence reported in men, significant drops in libido, sexual interest, ability to have intercourse, seen in some studies.
That's a really heavy list of physical impacts. What about cognitive or psychological effects? Are those mentioned?
Oh, definitely. Beyond the physical, psychiatric issues are commonly reported. Things like depression, anxiety, really severe mood swings, dysphoria, even rage and suicidality.
That's terrifying.
Yeah. And cognitive problems, too. Memory loss, brain fog. This seems particularly noted among women who received it as part of IVF treatments.
Okay. Any other major categories?
Heart conditions. Things like coronary heart disease, heart attacks, strokes, sudden cardiac death. Those seem particularly associated with use in men. And finally, pain. Just widespread, severe pain. One study of over 3,000 women found nearly 77% reported joint pain. And you see reports of severe body-wide pain all over patient support forums.
Goodness. And who are the main groups reporting these injuries? Does it break down by why they took the drug?
Yeah, the sources indicate that women actually make up the largest group of injured individuals.
Yeah.
Then it's people who took the drug to stop early puberty. After that, men, primarily for prostate cancer, and then finally transgender individuals using it as a blocker.
And there's concern about the long-term effects, especially for those who took it during puberty.
Yes, a major concern highlighted is that many who took Lupron for early puberty years ago are now experiencing these adverse effects decades later. And that raises serious questions about what the long-term effects might be for transgender youth using it now.
Right.
And it's really notable, the sources stress, that there's a real lack of controlled studies for Lupron's use in early puberty or for things like height enhancement. Its use there is based more on sort of expert opinion rather than solid long-term data.
Okay, so given that whole devastating list of documented harms, why haven't more people been successful with lawsuits against the manufacturer or maybe the doctors who prescribed it?
It's a really tough situation. There have been numerous lawsuits, but very few have actually succeeded, even in cases where the harm seemed pretty clear, especially from experimental or unapproved uses.
Why is it so difficult?
Well, the injured individuals believe, according to our sources, that the manufacturer just has these incredibly deep pockets from the drug's profitability. They mount these massive legal defenses. There are even allegations mentioned of things like securing gag orders and settlements to keep things quiet.
So it makes it hard to even find a lawyer willing to take the case.
Exactly. Many struggle to find attorneys willing to go up against that kind of legal firepower. The sources even mention efforts to formally collect evidence of harm, like something called the National Lupron Victims Network. Apparently, it faced obstacles and then just sort of mysteriously disappeared before it could publish its findings.
That's unsettling. Okay, this discussion about Lupron's use, especially in children, naturally brings us to WPATH. That's the World Professional Association for Transgender Health. Their guidelines carry a lot of weight in medical practice here. What do our sources say about WPATH's position on these hormone blockers?
Right, WPATH is influential. And according to the sources we reviewed, they set the guidelines for transgender medicine. The material suggests they strongly endorse giving hormone blockers like Lupron to children, while at the same time kind of downplaying or dismissing the known dangers associated with this practice.
So what specifically do their guidelines recommend when it comes to these GnRH drugs for kids?
Well, they advocate for starting GnRH analogs right at the earliest signs of puberty in kids who identify as transgender. The argument is that intervening early brings greater benefits.
I see.
They also suggest blockers as a temporary thing, maybe for adolescents who've already started puberty but aren't sure about starting cross-sex hormones yet.
Okay. Any other uses they endorse?
Yeah, they're recommended for individuals who are distressed by, say, menstruation or penile erections. The idea is the drugs stop those things, alleviating discomfort. And also for biological males who want to achieve female hormone levels later on, blockers are presented as helping with that. But what's really critical, and the sources emphasize this, is that while WPATH might acknowledge dangers with some other, maybe cheaper hormonal treatments, they seem to consistently downplay the risks of these more lucrative GnRH drugs like Lupron.
That selective disclosure is noteworthy. Now, what seems really concerning, and it definitely raises important questions, are the details coming out from those recently leaked internal WPATH documents, emails, internal discussions. What did those leaks reveal about what they knew internally versus what they were saying publicly?
Yeah, those leaks are pretty explosive. The documents reveal some, frankly, deeply troubling things. For one, internally, they admitted they were uncertain about the long-term consequences of using these blockers on kids. They essentially described it as a giant experiment.
A giant experiment. They actually used that phrase.
That's the phrase reported in the sources, yes. The leaks also showed they were aware of significant side effects happening in children, things like permanent loss of libido or the ability to orgasm, even potential harm to emotional development.
So they knew about these serious side effects.
They acknowledged them internally, yes. And here's a big one. Despite publicly claiming these drugs were reversible, the internal documents apparently show they knew that Lupron's effects were often irreversible.
Wait, so publicly saying reversible while internally knowing often irreversible.
Yeah.
That's the massive contradiction.
It's a huge discrepancy, yes. And there were serious concerns raised internally about consent, too. Basically, kids receiving these blockers are seen as too young to really grasp the long-term risks. Yet the push within WPATH-on was apparently to start treatment as early as possible.
That seems ethically fraught.
Absolutely. And maybe one of the most surprising revelations from the leaks was this internal push to affirm what they called plural identities, basically multiple personalities.
Multiple personalities. How does that relate?
Well, there were cases presented at WPATH conferences, even involving major institutions like UCSF, apparently, where individuals with diagnosed multiple personalities, each personality was sort of assessed separately on whether they wanted to transition. Yes. And in at least one case reported, some of the personalities did not consent to transition, but WPPath members involved still deemed moving forward with it ethical, and they proceeded.
That's navigating some incredibly complex ethical territory internally. What did the sources say about why they even started using puberty suppression in this way in the first place? What was the origin of that idea?
The sources explain that the whole idea, this experiment, it actually came from transgender adults who weren't satisfied with how their own transitions turned out later in life.
Okay.
So the theory developed that maybe if you could prevent natal puberty altogether, the person's final appearance after transitioning would be better, maybe more aligned with their identified gender.
I see the logic, but...
Right. And they apparently acknowledged, even as they developed this idea, that this approach would inevitably mean some kids who might not have persisted in transitioning would receive these powerful, potentially harmful interventions unnecessarily. But the potential benefit, like achieving a more feminine appearance for a trans woman, was judged to outweigh that risk of inappropriate intervention.
Wow. Okay, so given all of this, the history, the marketing, the dangers, the WPATH leaks, where does this leave things now? What's the future look like for these drugs and for medical practice in this area?
Well, the fact that Lupron has persisted for so long, despite everything we've discussed, the dangers, the questionable efficacy for many uses, our sources suggest that really points to some deep flaws in the broader healthcare system. There's a parallel drawn in some of the material to, say, the discussions around the COVID-19 vaccines or other past medical controversies. The idea is that the COVID crisis kind of acted as a wake-up call for many people.
How so?
It exposed some cracks in the medical establishment, in the infrastructure, and maybe made people more willing to question long-held beliefs or the pronouncements of major institutions. And that's led to much more intense scrutiny on groups like WPATH.
So increased public awareness and, I guess, the political climate have really started to shift the ground here.
It seems so. The issue has definitely become highly politicized, which has consequences. You're seeing public pressure leading to real action from major groups. Numerous Republican-led states, for example, and even England's National Health Service are now prohibiting or severely restricting the use of these drugs for gender transition in children.
So actual policy changes are happening.
Yes. And related to that, some states are also passing laws making it easier to sue doctors who provide puberty blockers to minors for transition.
Increasing the legal risk for providers.
Exactly. And as lawsuits against these doctors increase, their medical malpractice insurance costs are reportedly skyrocketing. It could potentially reach a point where it's just not financially viable for them to offer these treatments anymore.
So the financial incentives might start working in the other direction.
Precisely. It signals this growing acknowledgement, at least in some quarters, of the significant risks involved, and it might really be a turning point in how this is approached medically.
Well, this has certainly been an incredibly complex and, frankly, pretty eye-opening deep dive today. We've really traced the tangled journey of Lupron from its very specific origin through that aggressive marketing phase to its widespread and often controversial uses today. It highlights this sometimes really alarming mix of medical discovery, corporate profit-seeking, and shifting medical guidelines.
Absolutely. And, as we always try to emphasize, just having the information isn't enough. It's about understanding it, thinking critically about it. That's just so vital in the world we live in now, especially when it comes to our health.
So the final thought for you, our listener, maybe chew on, what really stands out to you from all this when you consider the documented dangers we talked about and those incredibly powerful financial incentives driving Lupron's use? What other medical practices, ones we might accept today without much question, could potentially be influenced by similar forces operating behind the scenes? What might be the next big medical reevaluation that we're maybe not even aware